Back in the late 70s, I was the president of a board of a not-for-profit agency. That was the agency that sponsored VISTA volunteers. And one year, like 1978, we were doing our applications for VISTA. And this small group of people from the South Side, mostly Hispanic, but not exclusively, came and said, we have this small clinic. And they were overstating it. It was barely a clinic, but they had really this little storefront.
Well, it turns out to be in a neighborhood where my father and his family grew up, so I've been around the neighborhood. But it was really a delight to walk into this storefront clinic, which at that time, was in 1976, was a storefront. It was what I really had wanted to be connected to, and was looking for a place to be creative and, give back to the community that I grew up in.
In addition to their jobs at local nonprofit agencies, they felt that the community as a whole was their job. And, that feeling of really providing services and taking care of the community where you live, I think that was a concept that was involved in 16th Street from the very beginning.
They needed some help on accounting and measures and reporting and just basic stuff. And at the end of 1978, the group, which was actually the board of 16th Street Community Health Center, it always had that name, asked me if I would be their director. And I thought, well, maybe. You sure? Because I was like, I don't really, an Anglo kind of East Side hippie kid, and don't speak Spanish and don't know healthcare. And they said, well, you know what, we like you. We trust you, we like you, that's what we need. Just help us out. So in the end of 1978, I became their first full-time permanent executive director.
And with the help of dedicated staff, 16th Street gradually transformed from storefront to health center.
It was hard to imagine how we got along with one door and the wind blew everything off people's desks. So the staff was much smaller and had a lot of people doing multiple jobs because it wasn't a full-staffed clinic as we think of it. It was a community health center. It was done and organized by the neighbors. It was run by a community board, and to me it was just where I wanted to be.
We weren't rigid around rules and roles. I mean, we used to come in on Saturdays and clean. We used to, we'd have paint parties to do the painting. I mean, we were really poor, but it really bonded us in the early years. The administrative office was upstairs here in a one-bedroom apartment. So the bedroom was my office. The kitchen, we had like a couple of students or volunteers would be in the kitchen. And in fact, the only bathroom up there was at the end of my office. So if anyone had to go to the bathroom, they had to come in through the office, no matter who I was meeting with or what I was doing, and then go in and close the door and go to the bathroom, then walk back out. The guy that owned the building, the whole building, was about 140 years old, and we knew he was going to eventually die, and the likelihood would be that we would lose the building. So we thought we ought to try to buy the building. So in 1983, or so, 83, 84, we started a fundraising campaign, and the guy wanted $90,000 to buy the building. Now, in perspective, that was $1 million to us. But we did get our federal grant, and we did buy the building. We raised the rest of the money. We bought the building. I had a good relationship with the alderman across the street. He knew that there were a lot of patients from his districts that came to 16th Street, and he was able to get us a grant for about $250,000. And with that $250,000, that was the first renovation of the clinic. We made it into a real clinic downstairs.
the goal at the very beginning was to just have a place where people could come and have services provided that weren't available at that time.
They basically set up a place for screenings.
The health department came in and did immunizations, and Planned Parenthood came in and did STDs and reproductive health. A couple of days a week, residents from St. Mary's Family Practice came in with a physician and did a little bit of primary care.
They had a number of other programs that would come into the clinic building to do services. And there was a small staff because a lot of the programs they were just coordinating or maybe staffing.
What we wanted to do is we wanted to eventually replace people coming in and doing stuff with our own capacity to do stuff ourselves. The people that came and got cooking classes and nutrition education in Spanish, in their neighborhood, they loved it. It was really what people wanted. This is exactly what health centers are supposed to be. In the heart of that community, supported by that community, involved with that community, managed and in a large part by that community. And it was really kind of what we did. It really was the way things were supposed to work. And they worked.